Hi everyone. I hope you guys are still awake, okay? And of course today is more like a theoretical, okay? And because this is under CME points and with the MMA Medical Association, so we have to stick to the side that we can only talk about the theory, and not, we can't endorse any products here. But tomorrow will be a different lecture. Tomorrow we have a hands-on. If we have a time afterwards, we will bring you to the lab tour. I don't want to make it so all the time sitting down here, okay? And of course, we'll do some hands-on tomorrow. Now, coming back to this integrative medicine, yesterday, you remember I was saying the word integrative. The word integrative means it includes all about UMDs, which we have been practicing. We call it conventional medicine. But you'll be surprised, in USA, they call the conventional medicine as traditional medicine. You see? So when you go US, it says traditional medicine, they're actually meaning the conventional medicine. Here in Asia, we call it conventional medicine. Traditional medicine, in a general way, most of the time in Malaysia, we refer them as TCM, So it's a scenario here. And yesterday, when I say integrative, it doesn't matter it's Ayurveda or Jamu or whatever. As long as it helps the patient, why not? As long as it helps the patient, as long as it do no harm, premium no nonsense, that is more important than anything else in our field, It's the same with me. I always say we all have to treat, our doctors all have to treat with good conscience. If it's going to harm the patient even on the long term, we will not do that. Even long term. They must be, I know in medicine there's a risk of a good risk and also a good advantage. I mean, pro and cons, you look at it, okay? So the good part about integrative is you look at all the good part. Are there solutions? Are there alternatives? This is important, okay? So these are prepared by my colleagues, so I just give a rough idea, And I cite one of the statements here, by Paracelsus, which is also the same name of my hospital in Switzerland at one time. It was the biggest wellness hospital, and we do integrative. We have 450 patients a day at that time, so you can imagine how much we learn about medicine, and we have one of the biggest dental centers around in Switzerland. Switzerland's are good with dental, okay? We have 4 dental surgeons down there. When we do implants in one day, those are the days. So you must understand the past before you can even know about the present, isn't it? And about the future. You must know something, what happened in the past. That's why we have to study history of a country or other things. We need the history. It's the same here when I say yesterday, when you look in the patient, every patient will come to you or some of the doctors send something, Mike, this guy is diabetic, but we need to know the history. So that's the reason you need a medical questionnaire. You can have your own type of medical questionnaire, but we also can have one which already prepared for you and you can do your modification because we ask the general questions. We need a history. We need some history of the parents or some genes problem. We don't know. We need to know if they come from a family of cancer, there's a high risk of that patient have a high risk of cancer too. So it's important, or high risk of autoimmune problem. So yesterday I also mentioned with the stem cells, when you took from another person, I'm not pro-animal or human. I only want to do my job. Which one works better for you? Okay? So everyone talk, oh, you are expert in xenografts, but what about human? We are the first people who do human too. Come on, in the 80s, who do humans? No one do humans. It's unheard of in Philippines, unheard of in many parts of the world, unheard of in Australia. The first one to go to Australia and do the stem cells too. We are talking about 80s and 90s, which is totally unheard of. Only the early 20s, even in Malaysia, it became very popular only around 2005 or 2006. But when we really come into Malaysia, we are talking about 80s and 90s. Those days, we call it cell therapy. Today, you call it stem cell therapy. I went to Australia in Perth, I went to Sydney, I went to Melbourne. Those are the days. It's education. With education, no authorities can stop us. Even until China today, until US FDA today, we are talking about education. No authorities can stop us. When you say application, then it's different whether they want to stop you or not. So there's no problem with education. Always remember that. I don't have a problem going to any country to do education. That is a good part. Okay. So we also have to understand the history of medicine. Right with the Egyptian, the Iber Papyrus, the Librarian site of the Iber Papyrus already at that time also involved animals. A lot of drugs are animals, today, even today, heparin, Alzheimer's drug by the name of cerebral lysine. So heparin is a drug coming from animals. What about insulin, the first peptides of the world? It's from animal. So it has been there all along. It depends on how you want to classify. Even with traditional Chinese medicine, it started 4,000 years ago. 4,000 years ago, they have been using it. They've been using animals until today. A lot of things are from animal parts. Man is the animal, the most intelligent animal. That is important to understand. Okay? The cell, the cytology of the cells in animals, including man, are the same. Not the organ. Cells or organs are the same, but not the organ. Okay, that's important. So if you look at this chart, all kinds of medicine around the world, long before Western medicine come in the 17th century or 18th century, long before that, it's been there all along. There are many kinds of medicine all over the world. You cannot say only one part is the best. I don't believe it. If you say the best medicine comes from UK or US, no. It's all over the world. Every country has had a contribution, just like you doctors, just like the scientists. They come from different parts of the world. They are good and bad in every country. Okay, it's not just one part of the world, you have everything. No, it's the same in medicine, it's the same in sciences. Okay, that's how we learn from everyone. I always say we learn from everyone. Every day I will spend 1 hour, what is the latest in nutrition today? What's the latest in drugs? What's the latest in stem cell research? So you have to be aware what is the latest, just like you have to be aware of what is the news around the world today, what is happening, the war around Gaza or all the other big Ukrainian wars, all this we need to know. Because this has all the effect on us, just like now we have the tariffs from Donald Trump. It affects the whole world. Everyone to a bit of standstill. They do not know what to proceed first. Okay, so it's the same in everything we do. It has an effect. Okay, so if you look at this chart, you can see that medicine doesn't come from one part of the world, it comes from different parts of the world. And you have to recognize the goodness of every part of the world, the medicine, every part. Okay, so again with the Egyptian, I always say cell therapy or stem cells, especially with xenografts, come from the Iber papyrus. That time they also talk about animals. It was so early, the first medicine of the world. So if you look around, there's so many other things. Ayurveda is a long one. Ayurveda involves a lot of, Bhavani is an expert in Ayurveda, okay, our educational director. And Ayurveda, in a way, is recognized in India. In India, the drugs of plant-based are all recognized, automatic approval. So if I bring the Ayurveda drugs or hematopoietic drugs, which I manufactured in Germany for 100 years, I took over a manufacturing plant before I came in. So it's been the first cancer drugs of Ayurveda, of hematopoietic-based, plant-based. It's 104 years old. Until today, it's one of the most popular drugs for cancer. They're all plant-based. And approved in Germany for 104 years, but if you bring to Malaysia, you bring to other parts of the world, it's not approved. But in India, automatic approval. So it depends on the regulation of each country, in other words. Even I bring to Hong Kong, I can't. I bring to Australia, I can't. You see the point here, okay? And I came up with the idea that individualized therapy. Individualized means you, the treating physicians, prescribe your protocols and drugs or concoctions of modality of treatments, including the drugs for that patient. That is allowable in all parts of the world, including US. Including US. Every patient has a right to use if they run into certain kind of terminal diseases or whatever. So it depends on the authority, how fast they approve it. It's the same in Malaysia. We are the first people who brought the stem cells. At that time, when we want to treat someone, the son of the politician, Abdullah Badawi, signed it off. We brought the Swiss, we brought the Americans, we brought the German down, and it was not approved in Malaysia, but we got approval to treat in Ampang Putri, those were the days, and it's stem cells for animal. So anyway, moving forward, what about TCM? TCM is approved in Malaysia. Even in University of Putra, you have it. It's allowed in Malaysia. A lot of cancer patients, when the conventional oncologists do not want to do it, they send to the TCM doctors. So I cannot say there's nothing good about TCM. They are, although they're more on the prevention base. But of course, when your wife wants to give birth, you won't send it to a TCM doctor. You'll go to a hospital. You see the point here? Okay, so there are good and bad things in everything. I just want to stress one point here. The German meridian points in biological medicine is the same with the Chinese TCM. The meridian point, not the way you put the needle, but the meridian point is the same. So it is important to notice there are some similarity in certain things. Okay, so again with the Greek, they have been one of the early part in terms of Western medicine. They started it, and then what happened? The Romans followed the Greek, and then you have with the Romans too. You see? So these are some of the history we're talking about. And of course, the father of medicine, came up with the oath, and that's how every doctors have to take up that oath until today. Okay? So there's so many other things coming across the world and influenced by different parts of the world. Same with Ibn Sina, okay? Or whatever you call him, I call him Ibn Sina. That was with the Arabic medicine. Then only you have the birth of Western medicine, quite a late stage compared to the rest. Okay, we are talking about the Renaissance, that's where they start to have a test on medicine. They open up the body, they study anatomy, and then today you have what we call medicine. The general use of medicine, conventional medicine, I always use the conventional. But what I always like in my life is integrative, because there are certain solutions in my life. I seriously think there's no solution in conventional medicine. There are solutions in other medicine. So I use the word integrative. So all our doctors are MDs. It's just that they also practice some form of integrative medicine in other forms of other modalities. So if you ask me what is the best form of treating a patient, especially a cancer patient, I would say modality of treatments and not just chemo or radio. Because in Germany, we will first look at your gut and your heavy metals first. That is the biological way of treating. If you don't have a strong immune system in your gut, which is part of your immune system, then how are you going to treat a cancer patient? Cancer patient is a compromisation of the immune system. Remember yesterday I said the thymus gland born bigger than your heart, producing the T cells, the immune cells. It's bigger than your heart, it's a big organ, and by the age of 25, it's shrink, and by the age of 65, it's totally gone, you only have particles. So where's the other immune system? Your gut. With some from the spleen, the production of your white blood cells. So this is all important part where that's the reason why you have to do regeneration of the organs. Okay? So if you look carefully, this is the part where everything in the later part, the birth of conventional medicines came from the Renaissance. That was with the Europeans at that time, the era, okay? But along the way, they came with other doctors. But when the Paracelsus, the Swiss physician, came up with the word similia similibus curanto, it was further endorsed by Samuel Hahnemans, a German doctor of homeopathy. So the similarity, the words of similia similibus curanto, like street lights, already give you a principle like what I say yesterday, all cells has similarity, they need the same blueprint. Okay? Why is it that to treat the liver, you use hepatocyte is better than the whole liver, or better than you use a heart cells, or a mesenchymal cells, or homopoietic cells? It's because it has the same molecules. Exactly as that. So why is it that to treat the eye, you need the optic nerve, the occipital lobe? Because that is what your eye needs. Without the nerves, without the retina, you can't see. But again, your eye see, your brain don't see. So that's the reason why you need the frontal lobe and occipital lobe to send a message to the brain, and the brain to relay the message. So there's a lot of things here I like to stress. I'm talking about the history here and what it comes about today. So all the history we have learned developed into something we have today. And what you learn today will be for the future. It's not only for the present, you know. Of course, so the next question is, when you are sick, what sort of therapy you are going to come up with? For us Malaysian, I remember we have Indians, we have Malay, we have Chinese, you know. We have our own way. A lot of us say you have to go to the hospital for surgery or chemo or radio for a cancer patient or whatever diseases. The first thing is you say, I will consider about it first. If you tell it to your mother or grandmother, they will always say, I consider about it. Number one, my age. Number two, can I withstand it? It's common. It's a common element in this. And some will say, I go and look for a Bomo. I go and look for the temple. I mean, the beliefs of all of us, okay? But I always say we have to be sensible and what is the right way to go. We have to be pragmatic, okay? The traditional way or the modern way or the integrative way. So when you say integrative, we use the word CAM. Complementary alternative medicine. Alternative means you don't want a conventional, you use for alternative. Complementary means you complement it with the current conventional, okay? So we call it in short CAM, but in integrative it's a CAM. We add in everything. We didn't forgo any part, you know? So if someone would say, like in the chart here, alternative means you don't choose this, you choose this, either A or B, okay? Complementary means I add my B to your A, which some of us are doing, okay? Integrative means everything. Whatever is good for the patient. So in our ways of moving with our centers, our own relationship with our doctors, you know, I believe we have been dealing with maybe 80,000 doctors throughout the conference of the world. I believe I've done more than 1,000 conferences a year, okay, because every week I'm in conferences. I continue to give lectures all the time, and I travel to 80 countries for that matter. And those were the days in the 80s, where we even talk about Africa. We still have a lot of relation from Africa. I have here Dr. Pamela from Nigeria. Her father was the first one, Perry. Pamela, you can put up your hands. Okay? She came all the way from Nigeria. And it's so difficult for Nigeria to get a visa to here. The Nigerian ambassador had to get the visa for her to come. And she brought a stroke patient a week ago, you know, and she's bringing a diabetic patient. But before her, when she was a child, I was with her father. Her father's dream was to bring stem cells to Africa. And that's how he set up the stem cells in Africa. But Dr. Perry has died. He came here too. Many years ago, he has died, you know. So the daughter is continuing the legacy. I'm so happy. I told her, you must realize the dream of your father. Your father spent all his life on this field. The first stem cell in Africa, not Nigeria alone. Today, of course, we have a lot of doctors sending a lot of difficult patients from South Africa. We have South African patients all the time. We have Australian patients all the time, sent by Australian doctors anyway. So it's all over the world. So the good part I like about integrative is you add up all this. You see, complementary, alternative, it doesn't matter to us. We only ask ourselves which one will work for the patient, which one will not harm the patient. If there's complication, then you be careful. Okay, if there are interaction, then you be careful. Even with conventional method, even the drugs cannot go with the supplements. I always say allow a gap. This is my own assessment, okay? I would say a gap. 2 hours, 4 hours gap. I will not take a supplements together with the drug in case of interaction. Okay, you don't know. So allow a gap, don't take at the same time. Simple as that, okay? And so that completes the word integrative, combining everything together. And it's good to use the word integrative so that we are less under pressure from any party. Because all of us are defensive. It's nature, human nature to be defensive. It's human nature to be selfish. So it's important to understand we have to protect ourselves all the time. We don't want to be attacked too. So I always say the first part is to be polite with people, to be kind with words, not just action, even to every patient who comes to us, irrespective of their status. It doesn't mean you're super rich, you can have everything. I just want you to give you a simple story. I have 7 princesses for the Middle East who came to us. And the appointment was 3 p.m. They came at 2 p.m. I made them wait 1 hour. They're very upset. Why must I wait 1 hour? I say, because your appointment is 3, you come at 2. There are some patients at 2, finishing almost 3. You're lucky they finish before 3. Because everyone is equal, irrespective of status. I do it on my way like this. It doesn't bother me. I always believe we all are equal. You win some, you lose some. You may not have all the money in the world, but that doesn't mean you're above than the rest who don't have money. You see the point here? Okay? So I believe in fairness very much, and I believe very much in kindness. Kindness with word to the patient is so important. Touching the patient before she has the infusion or before she has a jab, give her a bit of assurance of care. I believe in that very much. I told our nurses, you touch the patient before you IV. You do an IV. You don't just poke in, then she will jump up. These are some of the things we have to show care in terms of action. Some words with the patient is good, some kind words, okay? So ongoing is still continuing today. Alternative medicine or complementary medicine, or even the word integrative is getting very popular. Most part of the world, including US, are adopting integrative, which is good for us, And of course, with the Germans, we always call it biological, the Germans' way of calling biological medicine, which actually are complementary in a way, okay? So then there was a birth in the 1990s with Andrew. Andrew came up to the world, and that is how integrative medicine is used. He's a conventional doctor, by all means. But he endorsed it very well, and today we all remember what he said, and he's the father in that sense, and the US start to accept it. Today you have a US where they accept the complementary medicine in the way, okay? So that is a good part about the medicine. So all I want to say, it moved on, and then there comes the birth of stem cells, okay? That is where something came in more, okay? Before that, there was no stem cells, okay? Stem cell was a new finding. So again, cost effectiveness, sometimes it's just like in Malaysia. Someone have a treatment, you say, I don't go, I go to the TCM Sifu, he charged cheaper. I go to a conventional doctor, the consultation fee and drugs are more expensive. It depends on individual. I cannot say anything on that, okay? But it depends on what is the results going to deliver. Is it going to do a repair, or is it only a temporary effect? It is the same with conventional medicine. Someone has an autoimmune problem, psoriasis, you give the steroid to stop it. That is only temporarily. He will have another flare-up again. Did you solve the root? No. So the root is also important. How do you solve the root? You have to find the root before you can even solve the root. So we do not want just to treat the symptoms. We want to treat the root. It's like you don't sleep. You can't sleep. As you age, you sleep lesser. You have difficulty sleeping. Why? Because the pineal gland releasing the melatonin around the time of 9 to 11 suddenly is depleted. It shrinks lesser. Pineal gland is already less, your third eye. So when it shrinks lesser, the melatonin is not released, then you find yourself, you don't sleep after a certain hours, you become more awake, okay? Midnight, you're even more awake, okay, before you get tired. Then tomorrow, you're awake, but your brain is sleeping, okay? So because the delta waves is still there. So you have to understand all these factors. So the important thing now is, what are the solutions? As long as it is economical for the patient, it helps the patient, of course, that's the best solution, because not everyone is rich enough to afford everything, So when this move on, we move on to regenerative medicine, the new words come out, okay? And when you say regenerative medicine, something which is regenerating, that means it's mostly with the stem cells, okay? Because stem cells regenerate. Again, then you wonder now, you are saying stem cells, what about the other cells in the body? The real cells to regenerate your body, my answer is the stem cells, not the cells. You're born with 37.2 trillions of life cells, but the real cells to regenerate, when you're born 1 out of 10,000, the real stem cells are only 1 out of 10,000. By the age of 60, it's 1 out of 800,000 to 1 million. You don't have a lot of stem cells left by the age of 60 because you only have 5% level of stem cells for a normal person by your biological age. And your biology is older than chronological age. So it depends how you take care of yourself at the end of the day, okay? So it came in the early part, but some of the world top body at that time to start the certain association or education part, by certain physicians or certain scientists. These are some of the early bodies, okay? ASAM was a very early body. It's the oldest body in USA. In Europe. European Society for Prevention, Regenerative Anti-Aging Medicine started in 2003. I'm the only non-European who sit on the board. The only non-European, okay? I'm actually heading regenerative medicine for ASAM for the last few years. There's never been an Asian who lead it, but at this moment, I'm the ASAM chairman for Asia. That means in every country, we had to appoint a chairman. We had to appoint certain people to be part of the group. So the good part about the courses you have are also endorsed by ASAM. So the logo is there. Okay, of course, some of you who say, I want to be a member, you can always contact me. Okay, this is another European group. You have to be aligned with certain world-recognized group. That is important. And in 2006, we introduced to the world the world's first stem cell association. International Association of Stem Cell Transplantation. It was formed in USA in 2006 until today. I'm actually the co-founder together with my wife. we mold the idea because no one thought of association. You see, people are only interested in making money. People are not interested in taking the money to do the research or to do education. Education don't bring money. You lose money. Our education will always lose money, okay? Not the one you go for a university degree. But today we move also to masters in PhD in regenerative medicine. That you can contact Dr. Bawani, okay? We have physicians who took master and PhDs, okay? In fact, in Philippines, I also helped a Filipino doctor to become a master in regenerative medicine. And those days in Germany, her name was Dr. Ruby. Okay, she had a tough time, and I sent a doctor to guide her throughout in Dresden University at those days in Germany. This is a level I did. I spent all the money and did it for her. Okay, she needed a degree very much. So then we also started an international association for cell therapy, and that was formed in Switzerland too. So your course are certified by these two associations, which is good for you. So I know some of you have a lot of doctors in the past who say, Mike, I need a certificate. You're automatically a certificate after these courses, okay, for tomorrow, and day after. And you become a member, okay? So it's good. So you're subsidized. We don't even charge you at this moment, okay? You're actually having a lot of saving, more than $1,000 US. Now then, the regenerative medicine came in, there was a birth of stem cells, okay? Those days, in fact, long before the word of stem cells, it has been there since 1838. 1830 is a long time, you know. It's almost 200 years ago. It started with the French, the Swiss, and the German. Okay, those days they've been trying to test with all this, but those days they call it cellular therapy. Okay, they used to call it cellular therapy. Today you call it stem cells. In the old days in Germany and Switzerland we call it cellular therapy, and in Germany they call it organotherapy. The word itself, organo, already tell you it's organ. So you're targeting the organ. And in Switzerland and Germany they've been using the animal-based for until now. They're still using it until now. Okay, so the history of stem cells was a long history you have to understand. It wasn't just now. Of course, to us, to Asia, it has been quite new, okay? But actually it has been there in Europe for a long time. It wasn't the birth of stem cells didn't come from the Americans. It came from the Europeans, okay? So the good part about me is I learned everything about the animals, or people like us. We learned a lot about the human. We started with human. We didn't start with animal. We start with human, so that, but at the same time, we are also exposed to the animal, because in Switzerland and Germany, they only use the sheep, they use the pig, they use the cow. I don't take pork, so that's the reason, and because of the sensitiveness of halal, so obviously pig is totally out, okay? And in my case, you know, in medicine, we say the pig has the closest organ to human. Actually, there was another animal which is very close, the sheep. Sheep and pigs are very close to human, we all know that, okay? And that's why in science, a lot of organ transplantation are using sheep or pig. They use the pig more because most of the people understand the pig more. Now, in our sciences, we move on to found a new discovery, and that was a rabbit, and that was the best animal because rabbit is retrovirus-free. Retrovirus-free means you do not have a risk of zoonosis, and you don't transfer the disease to another species. That means you have two types of white rabbit, let's say from New Zealand, type A and type B. You have 1,000 type A and 1,000 type B. If one rabbit in type B has a disease, within 1 month, all the rabbits would die. But the one in type A, they are living together and none of them are sick or affected. None of them is dead. You see the difference here? This is only known to veterinarian doctors, not medical doctors. The vet doctors will tell you this. So in other words, people like us work a lot with vet doctors. We have 2 vet doctors here, okay? Including one who is a Sabah director of veterinary. He retired and he joined us, okay? So there's a lot we also have to understand about the animal. And of course now, when you talk about plant, it's accepted worldwide. We all know that, okay? Plant, you don't have any problem in any parts of the world. So it's a good entry. But if someone say, I give you plant stem cells, which part of the plant? The root, the leaf, or where? Are they really having the same exact molecule of an organ of a heart, or liver, or kidney? No, it's not exact. You can only get it from the animal. But when you say a plant which is bitter is good for a liver which is bitter, yes. There are very different plants which will do different roles and beneficial to human. Okay, so there are some good things about plant. Traditional Chinese medicine, a lot comes from plant too. Okay, so same with Ayurveda. So I will not ignore the goodness of plant. The Chinese and Koreans and Japanese do a lot with mushroom, and the Germans too. And we call it myco. But they are good mushroom, they're also poisonous mushroom. You also have to be careful. Okay, so there's a lot of things we have been studying around. My first love is always plant. I really love plants a lot, okay? But still, sometimes to treat the patient, in our own opinion, sometimes you can't do that. You have to do this. You can complement and support therapy. So this is something I did show to everyone yesterday. We talked about the different types of stem cells. Stem cells is so different type. Until today, just now, I was outside, some doctor asked me, I don't know which type of stem cells. You know, I'm very confused. Why don't you take from human? Why must you take from the animal? I say in the human, you can only have stem cells from the placenta or the umbilical cord when the baby is born. Okay, you can also take it from the fats in liposuction. You can also take from the bone marrow. You can take some from the blood. Okay, but the best stem cells, in my opinion, will be the bone marrow, but you have to do a bit of minor surgery. Okay, so what is the best part? The best part, in my opinion, is the bone marrow for human, but sometimes it's also difficult. So the best other alternative part will be umbilical cord blood. Okay, you take it, you can store it, you can keep it, and most of us are keeping it. Some of us, you know, they say insurance for your family, which I don't think you need to store. This is my personal opinion, because in Europe, no country store it. Because in European directives, you can't sell blood for money. In Europe, you can't. So there's no cord blood banking in Europe, only by public, the government, not with private. Of course, in Asia, it's different. It was a brilliant American idea, and he came in, you know, insurance for your family. Now, next is, if you need organs, you need to regenerate the organs of the brain. You need to regenerate organs of the heart, liver, kidney. You can't take it from the human anymore because you can't kill a human. So obviously, you will say, what about the placenta? What about the umbilical cord? They only have 2 types of stem cells. There are 400 over different types of stem cells, but here you only have 2 types, which is tissue cells, and we call it multipotent. And in Dr. Oha's lecture yesterday, she mentioned that they can turn into a few types. It's shown here too. These are the cells they can turn into. Nothing more than that. So we are talking about parenchymal organ, heart, brain, liver, kidney. They don't turn into brain, heart, liver, kidney. So how are you going to treat stroke patient if you need a brain cells? How are you going to treat a blind patient or people with eye problem, you need optic nerve occipital, or a kidney patient with kidney CKD stage 4 or stage 5? Or people with a diabetic problem of type 1 or type 2 diabetes? You can't. So that is the reason why you're forced to use the animal. But are the animal compatible? And I say they are, because there are drugs around the world from animal-based, which is a factor that has been used for so many years. There are thousands of drugs approved by FDA for animals to human, and also for animals to animals. Okay, and also can be human to animals, but of course you can't kill the human. So this is an important part you have to understand. One very popular drug for Alzheimer's called soluble lysines comes from pig's brain, approved in Europe for 70 years, still unapproved in Malaysia, Singapore, Hong Kong, Australia, or USA. Each time I go to USA, everyone asks, Mike, can you bring some of this over? So I told them we have something better now. Okay, so this is something you have to understand. Okay, because when you want to treat an organ, we want to treat a help of a patient, you have to know which part of the organ you need to treat. Of course, we know the patient is aging, all parts is coming down. All parts, your teeth, your bone, your muscle, everything, including going to the toilet, is different. Okay? Then your constipation problem, everything is coming in. Everything is aging. And you saw the chart yesterday. I told you about that. The 70-hour chart I showed you, that is important. Okay? Because we talk about every organ. So we prove to you, we cite the papers, at what age they go down. So this is also a very generalized summarization, which you can capture it and you will learn it more. Because we tell about the goodness of each and why not. So a lot of things are captured there, okay? And I did say you need the PowerPoint, I will send it to you too, including today PowerPoint and yesterday 2 PowerPoint. Send me a WhatsApp, I will send it to you. I'm always free to share. This is something you need to study about, to learn more. Because a lot of us don't understand, what is SPF, what is VAF? SPF means specific pathogen free. That means they're free from pathogens and viruses. This is the sources you want. That means every organ of the animal I take are free from this. You can't have human this way. You can only have animal because you have to put the animal in cavity. You can't lock a human unless it's jail for him for the rest of his life. Okay, but your animals you can, you see. I can put the animal here and you cannot get out from here for the rest of your life in this area. We can do that, but human we can't. Okay, so that's a good part where we can do with human, with animal. In Europe, you call it virus antigen free. The word virus means there's no virus. So these are even safer than human. Because when you take a stem cells from a human, you also have to understand. I said the transfer of autoimmune genes. If that guy has autoimmune, or family history of autoimmune, his autoimmune genes will go through your cells. Your body will talk to autoimmune. You don't have autoimmune, you have autoimmune. What if you have come from a history of family of cancer patients? So there's also a risk of the donor. Are you aware of the donor? Most of the time you don't even know. Okay, no record, nothing. So we have to be very careful here. So I say the future is still with the animal element. You still need animal. Now, what about cosmetics? What about hyaluronic acid? Some of you are aesthetic doctors. Every day injecting the fillers, hyaluronic acid. Do you know where hyaluronic acid comes from? One of the biggest sources. The coat of the hand, the male hand. You know, the red thing, the coat. COMB, that is from animal. Are you saying that there's a risk there? Are you not taking eggs Some of us are taking eggs every day. Okay, we are taking chicken every day, we take beef, we are animals. As long as you can inject, you can take. So even for cosmetics, all the cosmetics, a lot of them are tested on the eyes of the rat or the rabbit. Or you need to test. Where are you going to test? Of course, you have to choose an animal to test. You cannot be testing on human. So that is something we have to understand. Again, in human study, before the human study, you also have to do the animal study, right? Okay. So it's difficult to say. It's just like I say cosmetic has a lot of heavy metals. The women are putting lipstick, and then they adjust the mouth with the lipstick, and then the eyebrow, the eyelash, the hair color, all these are cosmetics. All these are strong, heavy metals. Heavy. So we are exposed to heavy metals all the time. Okay, you say you carry water with you, you don't go out, but you go out and eat. Do you think they use filtered water there? No, all the waters are tap water. Tap has been there for 150 years. It's still the old tap. Even in Hong Kong, it's full of lead. The government will say, yes, it's full of lead because you never change the pipe. The pipe is an iron pipe. It's not a stainless steel or copper pipe. It's an iron pipe. Please remember that. Okay, so we cannot avoid the element of heavy metals. We have to take them out. Of course, there's a way of taking it out. Okay, so these are some things we've moved on, in medicine. And then the stem cell story came in, but we didn't call it stem cells at that time because in Europe, it was not with the word stem cells yet. Okay, in 1989, while doing all the human anatomy, going with science at the same time, they're finding solution to treat diseases. So they cut the anatomy, they cut the body of the animals, they extract the cells and they start to inject. That was in 1838. Okay, that was the birth of the real stem cells. Okay, then the modern cellular therapy came in 1931. This guy is known as Professor Paul Nihans. He was he was treating the Pope Pius XII, and Pope Pius went on to live, dying in bed, live for 7 years, and he started to treat a lot of top people of the world, rulers, okay, all over the world, and he became a very famous person. And I told you I'm a disciple of his two partners. He had two partners. There are three partners there. So I'm the guy who is the disciple of the two partners because he has already died when I came into the picture. He died in 1972, okay. So La Prairie was a clinic he created, and he was in La Prairie, but La Prairie, after his death, there was a fight between the daughter, and they moved on. The La Prairie got bankrupt, and he was took up by an American banker, and he maintained it until today. La Prairie today is not the top center for cell therapy. It became a top center for cosmetic dentistry, okay, and cosmetic surgery, okay, because laws change, okay. So then the real hematopoietic cells came in the 50s, okay, with the discovery, okay, and this is where the birth of the conventional stem cells came in. Because we never used the word stem cells until here. Okay, and of course we went on here. So some of the top scientists came up, and this is where we have the stem cells here. Today we use the word stem cells. Those days we don't call the word stem cells. And on our side, we used to call them organotherapy and cell therapy, but when stem cells become more popular, everyone started to use the word stem cells. Okay, I still use the word cellular therapy to a certain extent to avoid certain FDA guidelines sometimes. Okay, but sometimes I will say biomolecular therapy is a better word to use. We both in that field. So when you say one of the early stem cells hospitals in Germany to use, this is Villa Medica. In 2017, we acquired the hospital. It's a 100-year-old hospital in this field. We acquired the whole hospital. We are still the owner of the hospital, and that is what we have today. Okay, so it's still there. Okay, of course, on the other side of different parts of the world, other scientists are moving the human and all that, and this is where in 1968, they have the birth of bone marrow. And it was so costly in the old days. Okay, today it's cheap. So again, if someone will say, Mike, do I need a bone marrow transplantation? I say, today's technology, we probably, if you have a cancer patient, you need the bone marrow, I can get the bone marrow from another place and give it to you. And it costs so cheap, okay? Because there are other technology to move with this now. Embryonic stem cells came in the way. We are also experimenting with embryonic stem cells in the 80s. But the risk of embryonic stem cell was that they can turn into all kinds of cells. Pluripotent means I can turn into all kinds of cells, the embryo itself. So there was also a risk of acting like a cancer cells because cancer cells is a normal cell which turn normal and turn into all kinds of cells with high metabolic rate. Okay, for that reasons, and because of ethical reasons, you can't take a fetus and take an embryo from the fetus. From the mother, and because of all this, everything stopped. So there's no embryonic cells anymore. Those days, even in China, they have military hospital. So again, move on to something created out with a Nobel Prize. Yamanaka was doing it in the early 2000s, and in 2012, he won a Nobel Prize for this. Okay, he came up with the word Yamanaka factors. A number of scientists today, including David Sinclair, the guy who introduced NAD. I was with him in April, and he was in Hong Kong recently. They are still doing a lot of gene therapy. Gene therapy is so costly, and you need time. How many people can afford millions? Not many. You need time, okay? So everyone asked me one question, Mike, what are you doing compared to what David Sinclair is doing and their team of people or Yamanaka is doing? They are into gene therapy, okay, especially with David and team, okay? One of the greatest scientists of the world today, Australian, from MIT to Harvard, is based in MIT, Harvard now. They are doing the reprogramming of cells. They reprogram from this to another, just like Yamanaka is turning the bone marrow mesenchymal cells back to embryo cells, and then you want to return it into other progenitor cells. You turn from the bone marrow to make into an embryonic stage like, and then you turn it to heart, liver, brain, kidney. A number of Japanese are doing all this, but it needs time. I just want to say it needs time. Okay, it could be time in 15 to 20 years. But what we have here is very different. David is reprogramming the cells. What is European wellness doing here? We are biohacking the cells. We are not going to reprogramming the cells. We don't have to. So when we biohack means I'm going to give you the hepatocyte for liver. I'm going to give you the retina for the eye. I give you the renal cells for the kidney. We do the isolations of the cells in the organ and give you that specific cells. So I didn't change anything. The A is still there, the B is still there, the B7 is still there, the B8 is still there, the Z10 is still there. You only select which one you need to take out. So that is the difference. So there is no risk of having carcinogenicity here because we have proven it in the last two lectures, okay? This is purely for education of what we are doing, okay? So the good part is, in stem cells, there are always solutions. Doesn't matter they're human or animal, there are some advantages, there are some challenges, okay? So there are good advantages, there are also some disadvantages. This is something I listed out, okay? And it's not invasive because you're not going to do a surgery to do all this. You don't have to, okay? Most of the time, it's either your IV or your IM. And I told you in IM, you have a strong dose. IV, you can't have a strong dose because all of them will be trapped in the lungs more than 90%. And yesterday with Dr. Pang talking about the mechanism, our immunologist, she showed you why they don't stay long, okay? What's the point of injecting? They don't stay long and they don't regenerate. Then it doesn't serve the purpose. So this is something important, okay? So what is the future here? Everyone asks, Mike, is stem cell the future of medicine? I tell you, stem cell is the present of medicine. Because a lot of things are not done, you can do it. Then why don't the pharma company take it up? A lot of people ask me the question, why don't pharma went into stem cell research? They went in very early. Eli Lilly lost millions in the old days, in the 70s and the 80s, because stem cells are biologicals. Biologicals means they have very small volume. It's not like a pharma, you produce a tablet or capsule by every second, thousands and thousands, same thing, okay, same formula. In the case of stem cells, you have to culture them. Whether it's primary tissue culture or other form of culturing or harvesting, you need a lot of human element. Yes, today we have robots to do that, but still, there's a limitation because there's a limit on how much you can do. You need a human element. It's different. It's different. That means to say you need a group of people to culture one set of cells for one patient. It's not having everything automation and do everything impossible. So it's like a Rolls Royce which is handmade or a Rolex watch which is handmade. And it seems like handmade costs more. In a way, yes, because of the labor cost and everything. And in our case, we really cost more because I'm a guy who don't compromise on quality. So I make sure that manufacturing is good because on my mind is deliver. If you don't deliver, what's the point of treating the patient? That is always on my mind. Even if we lose money, we will deliver. Sometimes we lose money. Okay, that is how we believe all along. I believe in that. Of course, with stem cells, there's many people who also make use of the buzzword, many years ago when you say stem cell cream, stem cell capsule, stem cell patch, I put it on and stem cell will be transplanted and see the result, zero. So don't believe anyone who says stem cell capsule, stem cell patch. To call something a cell, you must be alive. For a cell to be alive, you must have water, oxygen, and nutrients. If you don't have three elements like this, you can't be alive. All of us know you can't live without water. You can live without food for a long time, but not water, okay? So coming back to my personal story today is something to tell. I'm exposed to all kinds of medicine. As a scientist in this field with formulations, we have to do everything with the formula. We are one of the earliest people to formulate La Prairie Cosmetics. Can you imagine La Prairie Cosmetics is so expensive now, okay? La Prairie Cosmetics is an OEM brand in the old days, okay? They have the name La Prairie, so we came up with a cosmetic. It's different manufacturing. So we spend a lot of time on sunblock. We spend a lot of time on glycolic or AHA. In the 80s, no one talked about all this. No one used sunblock in the 80s. We are one of the first people who introduced sunblock to Asia. We are also the first people to introduce supplements. Those days, you heard of a brand called Imidine, but before Imidine, there was other supplements in Europe. Okay, and they came in, and that's how you capture the market. So in my personal opinion, it's either you lead or someone will lead above you. So it's either you lead along or someone will be above you. So you better be above someone and you lead first. okay? Or if you can't lead, then you better follow the leader. That's how I move in life, okay? I always stay with the leaders. I always like to prevent those people who are extraordinary because you learn from them too, okay? So this is my way of learning from everyone. I see everything in life. Life is a very painful process. I'm born very humble. I'm born in Plain Gate in the riverside. When it rains, I have my song with me, raindrops keep falling on my head. I'm very happy as a child. I stand on my water with water, I've been on my bed with water. That is my humble beginning. So I can tell you my own story is enough to tell you that everything can start small and make it very successful. Everything is possible, okay? And everything is guided by God, of course, okay? God decided to give it to you, you will have it, okay? Otherwise, you will never have it. But don't ask money from God or don't ask wealth from God. Ask God for wealth. Health is okay, not wealth, okay? So that is my basic understanding. And coming back to osteoporosis, you have been hearing so many lecturers about all this, okay? You have been hearing everyone, all the experts, and the whole lecture today is talking about osteoporosis and muscle. And I say you lose your muscles at 30, you lose your bone at 30. So what is the thing in stem cell research we can do here? Everyone found the diagnosis, gave the diagnosis correctly, but are they solution? We are the people providing the solution now. It's no point to know what is wrong with the patient. We want the solution, and we are the people, the solution provider, and that is important. So to me, a person can afford it to treat a knee, a bone, a shoulder, or whatever. We can easily inject peri-articular or intra-articular on a knee, easily. Okay, you give the cartilage with synovial. The synovial is gone. When the synovial is gone, they start to touch. Then you have erosion of the cartilage. Then you have inflammation. Then you have pain. So you need a placenta. Can you mix the NOP placenta with cartilage and all that? Oh, sorry, I said this is only an example. You can do that. Okay, they work wonderfully well. These are stem cell peptides. They're not even stem cells, so they are affordable. My personal experience. We do it every day. We do it all the time around the world. Because a patient comes to you and say, I have a knee problem, please fix me up. An ankle problem, elbow problem, a neck problem, shoulder problem. It's common. Okay, because all of us after 30 will face this problem. So the good part about in the stem cell research is you can give the cartilage, you can give the bone, you can give the muscle. You can even give the muscle. Of course, with the meal, I have a doctor from David, right? Peter from Hong Kong. He texted me yesterday talking about building the testosterone, okay? Or you need to have muscles. Yes, you need testosterone for muscles. You lose your testosterone, you lose your muscles, okay? So of course, we can do that easily. It's not just for fertility, you know. So there's a lot of things we can do here. Of course, if you want to balance it, you need the pituitary, you need the liver because liver is a hormonal modulator. You need the adrenals, which is also your libido for men and women, and the adrenals also take a function of ovary after menopause. So the adrenals is so important. So these are some of the factors we have, and along with it, the placenta. Placenta is always there, okay? But again, with people with high cancer marker, then we be careful because we don't want the placenta to stimulate. Other than that, placenta is one of the best wound healing. We have done a few publications on placenta. There's a book coming on placenta on our research because we spend a lot of time with the Japanese on research on placenta too. And we spend a lot of time with Indians who do human placenta. Human placenta is approved in India, for your information, just to let you know. Okay, so solution is that, are there solutions for all this? Easy. Similar simulus curanto. Bone for bone, cartilage for cartilage, synovium for synovium. Simple as this. That's all you need to do, and we can have it easily and affordable. That is important. It's very, very affordable. And Dr. Oha, one of our top osteoporosis doctor, arthritis doctor, he recommended, he's also our top cardiologist. So he recommended this device, and I brought this device in. This is the DEXA without the radiation. And this is what is the latest coming from the world, from Italy. And it's wonderful. You can see the device tomorrow, okay, or later in the evening. This is wonderful because we must always check your bone. Every man and woman who come to us, I say, I need to check your bone. I need to know how good you are with your bone density. Because when you lose your bone, you become hollow, you become shorter at the same time. Okay, we all become shorter as we age. And the merging of the bone. Radiation-free is wonderful, the results is wonderful, and it is cheap. Because when it's cheap, everyone can afford it, okay? So we did some publication along with all this. You know, there's so many other publications, you know, and of course, mesenchyme cells can turn into the cartilage or the synovium or the bone. Can. But I use the word may. Why? I know a lot of doctors use the word can. I rather use the word may because sometimes they don't turn. You treat 10 patients with knee problem, 5 have result, 5 don't have result. So I noticed that with mesenchymal cells. So my point is, I will give you the mesenchymal cells, I give you the cartilage, I give you the bone. It's better, isn't it? I give you the synovium. So it will be better in that way. Now, again, through our findings in this field, of course, some of us will use the human growth hormones. We also use the exosomes. We blend it along, and that means you can blend them. The good part about us is we can blend easily. So that is the skill in blending. What is the composition to use? That is important, okay? So again, along with that, there's so many studies on treatments of osteoporosis or with cartilage or bone, or even with the heart, you know. There's a lot of things. Stem cells has been providing a lot of good future. They can continue. These are our publications at University of California. You notice we do it on the dogs. We have 6 publications on dogs in USA with University of California. Okay, these are real studies. We spend millions on all this, and we are still funding all this. I believe there's a lot of good things we can do here. Okay, you notice it's allograft. That means it's from the own animal. We did that too. It's not just with a xeno. Sometimes you use allo and auto. So I believe there's a lot to learn here. We all have to learn until the day we die. We can't stop learning. We can't, because every day something new comes. I know I met a lot of old physicians that say, I know everything about medicine. Mike, you don't have to tell me. How do you know everything about medicine? Tomorrow there's something new again. Okay, something overlapped another, something has been upgraded. So you have to learn, all of us. The more you learn, the sharper it's good, and it's good for your brain, because your brain will not shrink so fast when you learn something. Okay, so like I say, the brain is very important. Longevity depends on health span and brain span, and it all depends on the cell span, the stem cell span, to be more specific. Thank you so much. Okay, if you have time, we give a tour afterwards. Okay, thank you.